بسم الله الرحمن الرحيم. طلبتنا الأعزاء، السلام عليكم ورحمة الله وبركاته. أنا دكتور فالح وحيد. محاضرتنا لهذا اليوم هي Functional and Applied Anatomy of the Hip Joint، وهي belong to Module Learning Objective 12 and 13. In this lecture, we will discuss the following learning objectives. In general, the hip joint will support the body weight during standing. It is one of the important joint for locomotion, and it is strong, stable, with multi-axial balance socket. It is synovial joint, consists from articulation between the head of the femur, which is the ball, and the acetabulum of the pelvis, which is the socket. Here, the head of femur deeply inserted into the acetabulum, unlike the shoulder joint. So considerable forces is required to cause injury in normal situations, especially the dislocation. Major trauma may cause hip joint injury, like dislocation, fractures, injuries to the joint surface, and associated structures. As I said, the hip joint is synovial ball and socket joint. It is stable joint, and the stability is important because this joint is designed for weight bearing, and actually this stability on the expense of the some mobility. إذا نتذكر shoulder joint هناك there is a wide range of movement on the expense of stability. هنا although it is ball and socket, but designed for stability and weight bearing at the expense of mobility. The movements that are possible in the hip are flexion, extension, adduction, abduction, medial lateral rotation and circumduction. يعني الموفمنتس اللي يصير بالبول and socket joint. وهذه nice picture for the hip joint. Show the articulation between the ball, that is the head of femur, and the acetabulum, which is formed by all the three hip bones اللي شفتوها بالدرس العملي. هذا هو الإلياك bone، وهذا البيوبيك bone، وهذا الإسكيوم. All the three are involved in the formation of the socket or the acetabulum. This is the head of femur, this is the neck, this is the greater trochanter, this is the lesser trochanter، وبيناتها الانترتروكانتريك line. This is an anterior view for the hip joint. Now we come to the first part of the hip joint, that is the head of femur اللي يكون شكله spherical، it is usually covered by hyaline cartilage. This is the articular part of the head of femur. In the center of the head there is non-articular part اللي سميناه fovea capitis، which is for the attachment of ligament for the head of femur. وعندنا أيضا neck of femur تكون شكلها cylindrical، it has angle in with the shaft of the femur in both anteroposterior plane and lateral plane. بالanteroposterior plane there is an angle between the neck and shaft يسمونها neck shaft angle، وإلها normal degree. If we look from the lateral view, we see also the head and neck has an angle with the shaft. If you look, you see the head and neck oriented anteriorly in comparison with the shaft. This is so-called angle of anteversion. So the orientation of the head and neck relative to the shaft, it is actually an angle both in anteroposterior view اسمها neck shaft angle، وأيضا if we look from the lateral view we see the head of the femur and neck little bit anteriorly in comparison with the shaft. This is called angle of anteversion. These angles are important for increasing the range of movements of the hip joint. This picture is nice. This, if we look from anterior or posterior, we see the neck shaft angle اللي هي normally 120 to 135 degree. إذا أقل من النورمال نسميه الحالة كوكسافارا، تكون أنجل قصير صغيرة، وإذا أكثر من النورمال نسميها كوكسا فولجا. وهنا هاي الصورة if we this is a line اللي يمثل الفيمورال line أو femoral alignment نسميها transcondylar line إذا خطينا line هنا. with the neck of the femur there is an angle between the femoral shaft orientation and head neck orientation هاي يسمونها الانجل of inversion اللي هي أيضا لها normal around 5 to 10 degree. this picture showing the parts of the proximal femur اللي أخذناها بالعملي وأخذناها بالمحاضرة السابقة عن osteology and radiology of the lower limbs. This is the head, neck, greater trochanter, lesser trochanter, وهذا يسمونه intertrochanter crest. This is a posterior view for the proximal femur. Now we come to the second part of the joint, that is the acetabulum, اللي nearly entirely encompasses the hemispherical head. يعني يكون الهيد deeply inserted in the acetabulum. والacetabulum يتكون من this part اللي هو covered by articular cartilage. hyaline cartilage يسمونه luneal surface which is broadest superiorly to support the head. And the acetabulum also has a non-articular fossa يسمونها acetabular fossa اللي contain a fat أو loose connective tissue of fat. وعلى ال edge of acetabulum there is a fibrocartilaginous color slightly increased the depth of the acetabulum called acetabular labrum. وinferiorly there is no luneate surface here. هنا luneate surface no, not present, but the acetabular labrum موجودة which bridge across this notch اللي اسمها acetabular notch. هسه هاي الacetabular fossa هاي acetabular notch and the acetabular labrum will bridge this notch, change this notch اللي اسمها acetabular notch to a canal or foramen. هذا الجزء من acetabular labrum we call it transverse acetabular ligament which convert the acetabular notch to acetabular foramen for passage of blood vessels from the obturator artery and vein. This is a nice picture show you the acetabulum. This is the luneate surface covered by articular cartilage. وهذه هي المارجن فايبروكارتيلاجينس ريم اسمها acetabular labrum. وهذه acetabular labrum will bridge the acetabular notch, change it to acetabular canal or foramen for passage of vessels. وهذا الجزء اسمه transverse acetabular ligament. where this is the head of femur وهذا هو ligament of the head of femur اللي carry blood vessels to the head. وهذه هي blood vessels come from the obturator artery, pass through the acetabular foramen and supplying the head of femur by part of the blood supply which is important mainly during childhood period. This is about the ligament of the head of femur which is usually consists from delicate connective tissue. So it is a rule for stability of the hip joint is minor and it is attached at one end to the fovea capitis وللother end It's attached to the acetabulum, to the acetabular fossa, to the transverse acetabular ligament, and margins of acetabular notch. And as I said, it carries branch of obturator artery which contribute to the blood supply of the head of femur. Now we come to the synovial membrane. There is a specific or special orientation of the synovium اللي هو جزء من الكبسول lining. It is attached to the margin of the articular surface of the femur and the acetabulum. فالاتاتشمنت of synovium حال أي synovial joint الاتاتشمنت يكون here to the margin of the articular أو يسمونها الارticular margin for the head of femur and articular margin of the acetabulum. It is usually line the under surface of the capsule, joint capsule, and from its attachment to the margin of the head يعني منه it cover the neck of the femur and then it reflects onto the fibrous membrane أو الجوينت كبسول. يعني هسه إذا نعيدها بصورة أوضح هذا الاتاتشمنت of the synovium هاي منطقة الاتاتشمنت to the articular margin of the head يجي down يغطي النيك of the femur اللي هي ما بيها articular cartilage وبعدين reflecting back to line the under surface of the capsule and this reflection يسمونها retinacular وهاي reflection إلى دور مهم because the blood vessels to the head of the femur usually run through this retinacular part وراح نجي عليها بالblood supply of the head of the femur. Now we come to the capsule which is strong and dense attached proximally to the edge of acetabulum to the glenoid labrum transverse tabular ligament and distally along the intertrochanteric line anteriorly and attached to the intertrochanteric line anteriorly but posteriorly it is reached just proximal to the intertrochanteric crest but not attached to the crest. In addition to the capsule, it is strong. It is further strengthened by three important ligaments for the stability of the head and stability of the joint as a whole. And these ligaments are usually extracapsular. We have the iliofemoral, pupofemoral, and ischiofemoral ligaments, which are spiral from the hip toward the femur ومن اسمها الإليوفيمورال يعني between the ilium and the femur وهكذا بقية الأسماء. These ligaments are very important for the stability of the hip joint, especially the iliofemoral ligament, and it is usually prevent excessive movements of the hip joint, especially excessive extension. So these ligaments become taut during extension and usually become relaxed during flexion. Other ligaments اللي هو transverse acetabular ligament and ligament of the head of the femur. These ligaments usually intracapsular and considered as accessory ligament. But the main stabilizing ligaments are the extracapsular ligament اللي هي the three ligaments iliofemoral, pupofemoral and ischiofemoral. Mainly iliofemoral ligament. The factors responsible for the stability, the hip joint, as I said, it is one of the most stable joints in the body, in which the head of the femur deeply inserted in the acetabulum, so the bony stability is very important in the hip joint. In addition to the bony stabilizing structures, the strength of the capsule, the ligaments, capsular ligaments, all these are important for the stability, in addition to the muscles that are crossing the joint and acting on the joints, also important for the stability. So the stability of the hip joint comes from the bone, from the capsule, from the ligaments, and from the muscles around. These are the muscle working on the hip joint, the muscles responsible for flexion, mainly the iliopsoas muscle, اللي هي psoas and iliacus, in addition to the muscles in the anterior part of the thigh, اللي هي tensor fascialis, sartorius rectus muscles. These are responsible for flexion, but the prime mover for the flexion actually it is the psoas and iliacus, سمونها iliopsoas. And the adductor muscles are mainly the adductor longus, adductor brevis, adductor magnus, gracilis muscle, and iliopectineus muscles. These muscles are responsible for adduction, and the muscles responsible for extension are mainly the gluteus maximus muscle, in addition to the hamstring muscles also involved in the extension. الهامسترنج muscle تتكون من البايسبس semimembranosus and semitendinosus. We have rotation, عندنا lateral rotation وعندنا medial rotation. المسل responsible for lateral rotation actually the gluteus maximus plus what is called short rotators اللي هي البايريformis, superior inferior gemellus, obturator internus and externus and quadratus femoris. And the muscles responsible for abduction and medial rotation are the other gluteus, اللي هي gluteus medius and gluteus minimus. These are the muscles responsible for the wide range of movements of the hip, and we should know important to know the muscles acting on the hip joint. Now we come to the nerve supply. The nerve supply to the hip, usually according to the Hilton law, which states that the nerve supplying muscle extending directly across and acting at a given joint actually innervate the joint. واضحة هاي العبارة. فمن hip joint we have branch come from the femoral nerve, obturator nerve, sciatic nerve, superior gluteal nerve, and nerve to quadratus femoris. فكل nerve supply a muscle passing across the joint, actually supplying the joint also. Regarding the vascular supply, actually it is predominantly through branch from the obturator artery, medial lateral circumflex, femoral artery, the medial and lateral circumflex, flex artery which come from profonde femoris artery, and first perforating branch of the first perforating branch of the deep artery اللي هو deep artery of the thigh اللي هو قلنا اسمه profunda femoris artery. The articular branch of these vessels forming a network. نشوف main blood supply actually come from medial and lateral circumflex artery, mainly the medial circumflex artery, واثنيناتهم يجن from the femoral artery from deep artery of the thigh أو يسمونه profunda femoris artery, and some vessels come from the internal iliac artery اللي هي via the superior gluteal artery and inferior gluteal artery. The lateral and medial circumflex arteries اللي هي as I said come from the deep artery of the thigh or profunda femoral artery, travel in the capsular retinacula هاي اللي حكينا عنها. الكابسولا retinacula اللي هي reflection of the capsula and synovium toward the head of the femur, وهذا reflection carry with it these blood vessels. And these blood vessels اللي هي retinacular blood vessels which are the main blood vessels for the head of the femur in adults especially may severe during fracture of the neck. يصير كسر هنا ممكن these vessels are damaged. وإذا صار damage these blood vessels actually the head of femur probably might die. وإذا died head يسمونه a vascular necrosis of the head of the femur. The femoral artery also receives blood vessels from the obturator artery via the ligament of the head of the femur, but this is important blood supply during childhood during before closure of the epiphysis. We have persa belong to the hip joint اللي هي البيرسا تعريفها it is a membranous sac معطينا هذا التعريف lined by synovial membrane containing capillary layer of slippery fluid اللي هو synovial fluid. البيرسا contain the synovial fluid as the hip joint أو as any other synovial joint. وعادة البيرسا موجودة بالمناطق اللي يصير there is friction two surfaces of friction whether between the bone and ligaments or between bones and muscle and so on. Example إلها هي the where the iliotibial tract across the head هذا iliotibial tract cross the greater trochanter and to avoid friction between the iliotibial tract and the greater trochanter there is persa intervening between them هاي البرسة اسمها trochanteric persa which is the most important persa around the hip around the hip joint. So as I said, the trochanteric persa it is the largest and the most important persa between the iliotibial tract أو the gluteus maximus muscles اللي هي جزء من الاليوتيبيال tract الاتاتشمنت مالتها الانسيرشن of the gluteus maximus muscle and the posterior surface of the greater trochanter. وقلنا فائدته هو to reduce friction. We have other persa موجودة around the head but the largest most important is the trochanteric persa اللي هي البقية من عندها مثلا persa belong to iliopsoas muscle وpersa belong to the gluteus medius وpersa belong to the called ischio-gluteal persa. So we have other persa. الإليوبكتيريال persa أو اللي هي belong to the iliopsoas muscle it lie deeply at the deep surface of the iliopsoas muscle and actually also its function is usually to prevent friction and it might communicate with the joint cavity in 15% of individual ممكن تكون separated usually but sometimes communicate with the synovial cavity of the hip joint and the swelling of this persa may present as synovial cyst of the hip joint below the inguinal ligament هذا البرزنتيشن إذا صار به swelling because it is anterior. Other persa as I said ischio-gluteal persa أيضا can be become inflamed due to excessive friction as riding bicycles وهاي موجودة هنا ischio-gluteal persa ممكن يصير friction بالrepetitive flexion extension of the hip مثل riding bicycle أو also during riding horse due to friction. Inflammation of the persa احنا نسميه bursitis الكمن هو التروكانتريك bursitis وممكن يكون جزء الانفلاميشن هذا جزء من disease الانفلاميشن of a joint اللي هو arthritis أو يكون separate entity due to excessive friction. The common diseases من كملنا الاناتومي we have some diseases or disorders related to the hip joint أول واحد حكينا عنها هي البيرسايتس the most important is trochanteric bursitis ممكن يصير dislocation بالهيب joint كلش common problem الcongenital dislocation acquired also possible here femoral neck fractures it's common ممكن تكون intracapsular يعني بداخل الكبسول fracture أو extra capsular نسميها peritrochanteric fractures bursitis اللي حكينا عنها و we have also arthritis اللي هي inflammation example إلها osteoarthritis and rheumatoid arthritis والosteonecrosis أو نسميها الavascular necrosis of the head of the femur. These are the common disorders affecting the hip joints. We try to discuss each one briefly as possible. Start with the dislocation قلنا could be congenital, could be acquired. The most common congenital dislocation usually occur in the hip joint, occur in about 1.5 pairs in each 1,000 pairs. It may be bilateral, usually affect the girl more than boy. The acetabulum here, if you see, it is shallow. in comparison with the normal. This is a normal. You see how much the socket is normal. Here you see it's shallow, and the head of the femur is driven forward, sorry, backward and upward. وهذا يؤدي إلى the affected limb become shorter than normal because the head is driven superiorly. Other problem يسمونها dislocated epiphysis of the femoral head. الاسم الثاني إلها هذا هو الاسم المور كمان يستخدم بالكتب هو slipped capital femoral epiphysis. This is the name of the dislocated epiphysis. هذا يصير in older children يعني العمر 10 إلى 17 سنة. هنا شو يصير الابيفيسز هذا هو الابيفيسز هذا الفيسز وهذا النك. Usually here the epiphysis may slip away from the femoral neck سببه due to weakness of the epiphyseal plate due to an underlying cause. ممكن تصير بسبب acute trauma يعني single trauma أو repetitive micro trauma فيصير repetitive shearing forces على الابيفيسز ويصير ب slipping. وهذا السليبنج ممكن يكون partial ممكن يكون complete. هنا الديسلوكيشن يصير بالنك النك تطلع out but the head i.e. the epiphyses still remain in the acetabulum. هذا شو يسوي لنا يصير النك شافت انجل راح تصغر ويصير progressive coxavara. The common initial symptoms here is pain and discomfort in the hip referred to the knee. وإذا الحالة ما تعالجت وما شخصت ممكن تتطور إلى كوكسافارا وممكن يصير shortening باللم وليمبينج وممكن ينتهي complete dislocation of the neck from the epiphysis. We have also acquired dislocation. هذا uncommon خصوصا إذا قارناه بالشولدر dislocation اللي هو common. The most common is the posterior dislocation بينما بالشولدر قلنا the most common is anterior. وعادة تصير بحالات الرود ترافيك accidents اللي هي during the driving accidents وممكن يصير posterior dislocation. وهنا الفيمورال head forced out of the acetabulum come posteriorly and damaging the capsule of the joint. presentation clinically the limb you see here the limb is flexed, adducted, internally rotated and shortened. So these are the characteristic signs of the posterior hip dislocation. Clinically the limb is flexed يكون شكلها flexion, adduction, internal rotation and shortening. These are the four characteristic signs for the posterior hip dislocation. ولين الديسلوكيشن يصير posterior وحسب ما تعرفون the sciatic nerve lie posteriorly. So this dislocation might injure the sciatic nerve. فإذا يجيك مريض عنده posterior hip dislocation you have to check for the integrity of the sciatic nerve. وشلون نفحص integrity? By assessment for the structures supplied by the sciatic nerve اللي هي hamstring muscle اللي هي responsible for the part of the extension of the hip and flexion of the knee والmuscles of the ankle and foot اللي هي distal to the knee joint and sensory deficits in the areas supplied by the sciatic nerve in the leg and almost all the foot. ممكن يصير anterior traumatic dislocation? The answer is yes, but it's uncommon in comparison with the posterior and عادة due to a violent force in reverse to the posterior. هنا يصير extension, abduction and lateral rotation. And here the femoral head become inferior to the acetabulum, not superior, inferior to the acetabulum. هذه هي one of the most common injuries راح تشوفونها تواجهوها بحياتكم بالهب injuries اللي هي الفراكتشر of the proximal neck femur. وهذا the proximal femur the proximal femoral fractures اللي تنقسم إلى قسمين. قسم يسمونها intracapsular يعني بداخل الكبسول of the joint وقسم يسمونها extra capsular. الانترا كابسولر بها ثلاثة. الأول اسمه subcapital ويكون at the junction between the head and neck والثاني اسمه ميد سيرفايكال يكون بالميد بورشن اوف ذا نيك، والثالث اسمه بيزي سيرفايكال ويكون بالبيز اوف ذا نيك. all these fractures يسمونها intracapsular inside the capsule. وخلي ببالكم الفراكتشرز يصير intracapsular carry a risk of injury to the retinacular blood vessels. وإذا صار injury to the retinacular blood vessels there is a risk of the head of femur died ونسميه avascular necrosis. The most common of these fractures that carry this risk is the first one اللي اسمه subcapital fracture neck of femur. ممكن الفراكتشر يصير extra capsular، نعم، اللي ممكن يصير along the intertrochanteric line يسمونه intertrochanteric fracture، وممكن يكون جوا الانترتروكانتريك اسمه subtrochanteric. هاي يسمونه extra capsular which carry minimum or no risk of avascular necrosis because it is usually not causing a damage for the retinacular blood vessels. So, disruption of blood supply, as I said, to the head of the femur via the circumflex artery might occur, especially the medial circumflex, اللي هو main blood supply for the head, might occur in fracture neck of femur. I mean the intracapsular fracture. While the intertrochanteric fracture, اللي هي extracapsular, do not usually disrupt the blood supply to the femoral head, so it does not carry a risk of a vascular necrosis for the head of the femur or death for the head of femur. The femoral neck fractures اللي هي intracapsular, it might be occur in young and in elderly patient. In young patients usually rare and usually uncommon, not rare, it's uncommon, but need high velocity trauma and usually need treatment by fixation as early as possible. You have to fix يعني نسوي surgery تثبيت للكسر باليونج إذا صار as early as possible to reduce the risk of avascular necrosis. ممكن تصير بالelderly. It is commonly usually occur in elderly especially in women بسبب يكون البون ويك بسبب الاوستيوبروسيس. البيشنت شلون يجي لك؟ يجي لك the limb is shortened يعني قصيرة and laterally rotated عكس ال posterior dislocation. هناك يصير internally rotated and the femoral head is maybe deprived of blood supply يخسر وينتهي بavascular necrosis. وإذا انتهى بavascular necrosis يعني إذا صار death بالهيد بعد ما يصير له حل إلا تسوي له hip replacement تبديل مفصل يسمونه. هذا ينشال الطبيعي ويتبدل بواحد بروستاتيك أو سينثيتيك. الانترتروكانتريك fracture اللي هو الاكسترا كابسولار also might occur قلنا وبيها ما بيها risk of vascular necrosis، بينما الانترا كابسولار بيها risk of avascular necrosis. هذه تحتاج usually fixation as early as possible in young especially in young patient. في الاولد age يعني ممكن واحد يلجأ إلى joint replacement instead of fixation أو يسوي fixation. هسه هذا مو موضوعنا حاليا. We have also diseases كملنا التروما وعندنا diseases for the hip joint اللي هو الارثرايتس على رأس القائمة اللي هو تعريفه inflammation of the joint. وكل inflammation عادة if present it's usually start in the synovium وبعدين يتطور will affect the articular cartilage وإذا تطور أكثر ممكن affect the bone according to the stage. بالبداية عادة الأرثرايتس present as pain. بالبداية البين يكون بسبب الانفلاميشن that affect the synovium، ومن يبدأ الارتيكولار كارتليج يتضرر ويصير بيه دمج راح يصير رفنس بالسيرفس يعني الارتيكولار كارتليج دمج، فاكو منطقة بالبونز تكون not covered by cartilage فيصير mechanical friction، وهذا الميكانيكال راح يسوي لنا severe pain وراح يسوي لنا limitation أو stiffness. الاوستيوارثرايتس of the hip might occur، ممكن تكون جزء من generalized osteoarthritis وممكن تكون بسبب تروما خصوصا الفراكتشر around the joint. والاوستيوارثرايتس بالاكس راي راح نشوف there is narrowing and irregularity of the joint line وسببه because of the damage of the articular cartilage ومناطق من المناطق من الهيد او من الاستابيلم نسميها bare spots يعني مناطق not covered by cartilage bone here exposed وهذا as I said will lead to mechanical friction وممكن يسوي لنا ايضا further inflammation stiffness and severe pain. روماتويد arthritis هذا purely او mainly inflammation وقلنا الانفلاميشن يبدأ بالساينوفيوم وبعدين يتطور يوصل للارتيكولار كارتليج وبعدين يوصل إلى البون according to the stage of the disease. Other problem commonly affect the hip joint هو الاوستيونيكروسيس أو الاسم الثاني له avascular necrosis وهنا الهيد أو femur deprived of its blood supply فإذا انقطع عنا البلد whatever the cause أكو هنا فقط الاطلاع يشوفون how many causes for the avascular necrosis وإذا صار الهيد death صار به death cannot withstand the stress of walking بعد من يمشي المريض ما يتحمل فايش يصير به؟ يصير به collapse و become irregular in shape ممكن predisposed to secondary osteoarthritis and degeneration for the hip joint. Other problem might occur هنا the cause is idiopathic هنا هو هم avascular necrosis but it is idiopathic وعادة تصير بالأطفال بعمر 3 إلى 9 سنوات وهنا the blood supply to the head is disrupted and the femoral head especially the epiphyses become compressed, irregular and misshaped. There is a good chance here for regeneration and regrowth and recover from the disease or the problem might be progress until adulthood. These are the references for our lecture and thank you.